Tell you a little bit about spinal cord stimulation and peripheral nerve stimulation, and this is going to be just a little bit of a 10-minute romp through this area, and it's not really aimed at bringing you up to speed on all of the literature on placement, because I imagine most of you won't be primarily placing these devices. Really just want to know when to refer and sort of how to think about these in terms of your practice approaches. So we'll talk a little bit about technology, a little bit more about why spinal cord stimulation is analgesic, and a little bit about the safety. And then we'll talk about peripheral nerve stimulation for its only back pain application that I'm aware of. We use that for many other things, and I'll explain a little bit. Yesterday, I kind of got the hook at the end of my talk, so it wouldn't be a good nociception lecture without a reference to an American literature giant. So you'll see that, as was said, I didn't have time to write you a short letter, so I wrote you a long one. So today I got it down to just a few minutes, despite the extra time that slide just took. So in terms of spinal cord stimulation, most 90+% of spinal cord stimulation devices are placed with percutaneous electrodes done with an epidural needle through the skin, interlaminar approach, loss of resistance technique with a syringe. Many of you have probably done that procedure at some point along. And then the electrode is guided into the epidural space, as far up as you want, foramen magnum to retrograde into the sacrum, wherever you want a needle electrode. Most of us can put it there, and that's done obviously with fluoroscopy. Occasionally, these are done because of migration or whatever, and you guys are asked to help us in the OR to put those in with a direct vision and place them in the epidural space for longer-term use. Peripheral nerve stimulation is a newer therapy. There are about 4 commercial projects in the marketplace.